Hi there, my name is Lainey, and we're going to talk about the structures of the eye as well as some abnormalities that may occur with those structures. So here is our eyeball. Now the eyeball has three separate layers to it. The outermost and toughest layer of the eye is comprised of the sclera right here along with the cornea. Now the cornea is the first structure in which light will come through in order to produce an image. The second most inner layer is the choroid, which is right here depicted in this dark reddish orange, and the iris, which is right here, and that is the colored portion of our eye that we see, as well as the ciliary body, which is right here and right here. Now the ciliary body is responsible for producing wetness that will go into the anterior chamber of the eye as well as the posterior chamber of the eye to keep it wet and to keep it nourished with nutrients. The lens, which is right here, kind of is suspended through suspensory ligaments that exist right here. Now what happens is the lights come through the cornea, it goes through to the lens, and then it sends it to the retina, which is the innermost portion of the eye, which is directed here, and the retina is responsible for taking the light that is bent through the lens and for turning it into a sharp image. Now once that image has been produced, it then sends it to the optic nerve, which is right here, and then it travels to the brain for the image to be interpreted. Okay. Right here, what we see, we've got arteries and veins. That is called the vitreous body, and that actually keeps the eyeball nourished with nutrients, with blood flow, oxygen, all the nutrients it needs in order to continue to work. So three abnormalities that you may find with the eye are dry eyes, corneal opacity, and diabetic retinopathy. Now, with dry eyes, the tear glands don't produce as much tears on the eye, which results in like an itchiness, a burning sensation. You might find some reduced vision due to that, some blurry vision. There might be sensitivity to light. So the diagnostic testing that's involved is a dilated eye exam, which will help determine how much fluid is actually in there and how much is missing. So the treatment for that is typically really easy. It's usually just over-the-counter eye drops that you can place to kind of replenish some of that fluid that's there. Some education you'll want to give to your patient is to avoid any kind of smoke or wind or air conditioning being blown directly into your eye, which will actually cause it to dry out. Maybe add a humidifier in the home, limit screen time on your phones, on your monitors, your computers, your television. That tends to dry out the eyes. Drink plenty of fluids in order to replenish the fluid that's being lost in the body, and then to drink to sleep 7 to 8 hours a night. For corneal opacity, usually that occurs due to some scarring that happens on the cornea. And that scarring keeps the light from being able to come in and producing an image off of the retina. So some symptoms might be like an itchiness or like feeling like there's something in the eye. It might actually turn milky. It'll be less translucent, more opaque. It's kind of like a whitish color. So that reduces the amount of light that can come through, and the vision, ultimately it hurts the vision. So we can conduct a dilated eye exam and do a Snellen eye chart to see how much of that vision is actually being hurt. Medication, usually there's some steroids or antibiotic that is provided. We can do eye drops, and if the scarring is really bad, then the patient may choose to go into surgery to get that scar removed. Diabetic retinopathy, that actually occurs for those who have diabetes. And what happens is that the blood vessels that exist in the retina start to deteriorate and diminish, thus keeping the retina from being able to receive light and produce an image. Medication is the treatment for that. We could also do some laser treatment to kind of reattach the blood vessels or go into surgery. The testing that's involved is a dilated eye exam and a Snellen eye chart. If you have a patient who has diabetes, be sure to educate your patient and let them know that they need to be getting a dilated eye exam at least once a year. They may not feel any symptoms in the beginning, but towards the end, what they'll feel are some blurry visions, they might see spots in their vision, and then ultimately they may not see anything at all. So preventative is the best way to make sure that we keep our vision for those who have diabetes. Some nursing assessments that are good for all eye abnormalities is to take a look at the perilla. Make sure that the pupils are equal, round, reactive to light, and have accommodations. Check the extraocular movement and be sure to check the peripheral vision. So every structure of the visual system is subject for changes as a person ages. Cataracts occurs when an opacity comes into the lens and it distorts the image being projected onto the retina, and thus it causes the vision to be blurry. The diagnostic testing involved is ophthalmoscopy, slit lamp microscopy, and glare testing, which will quantify the vision loss that is associated with the light scatter. Some treatments would be keratometry, which is surgery, and that will assess the curvature of the cornea, and then an A-scan ultrasound will obtain the measurements for an artificial replacement lens if that is necessary. What you want to do is administer all pre- and post-operative medications that are prescribed by the physician. You definitely want to teach proper medication administration after the surgery if that is something that the patient does. Want to make sure that you modify the environment for safety, teach the patient where everything is, inform the family what is considered safe, teach the patient to wear sunglasses when they go outside, and to make sure that they intake antioxidant vitamins and have a good balanced nutritional diet. The goal for all of this is to reduce anxiety, make sure it's nice and minimal, and to provide the patient with as much information as they need to make an informed decision on how they want to go forward. Glaucoma is a disease that causes increased intraocular pressure in the eye, and the tissue damage due to that pressure will actually exist in the peripheral vision. So someone who has glaucoma will start to see a decrease in their peripheral vision and unable to see at that point. Some symptoms that they will experience are darkness, a gradual loss of their field of vision, halos around lights, their vision might be blurred, and you might see some ocular redness. The biggest nursing consideration that we have for glaucoma is to keep the intraocular pressure as low as possible. Some diagnostic testing that we would encounter would be a visual acuity. Want to see what they can see and how far out their field of vision or how much loss in their field of vision has occurred. Ophthalmoscopy. We'll want to do a gonioscopy, which is an examination of the anterior chamber right here of the eye to see if there is any fluid that has been drained from the eye, or if the eye is open, or if it has been closed. We'll want to do a slit lamp microscopy or a tonometry, which will measure the intraocular pressure that is existing around the eye. Age-related macular degeneration, or AMD, is a deterioration of the individual's central field of vision. What happens is cells begin to atrophy, which lead to a very slow and very progressive, painless loss of the visual field, and it is completely irreversible to the central vision loss, and it is one of the most common causes of central vision loss for individuals over the age of 60. It is related to retinal aging, and genetics do have an ability of playing a role. Some symptoms that one will find are blurred vision. There'll be a decline in central vision. There might be some blind spots, and there might be some distortion of the central vision. Some diagnostic testing that you may want to consider is visual acuity. You might want to check the Snellen eye chart test, maybe do an Amsler grid test, fundus photography, or an optical coherence tomography. It's the OTC scan, which measures your peripheral vision and field of vision to see what is actually being lost. The goal for our patients is always to retain as much independence as possible and to accept the impairment or the visual impairment. You might want to identify some community resources, and that would be the case with any of our degenerative eye disorders or any eye abnormalities. As a person loses their eyesight, it can be a very hard thing to consider. You always want to make sure that the patient understands what is happening with their eyes, that there is some knowledge behind the disease process, establish their current baseline so that you always know how much and how quickly they're degenerating or the disease is progressing, and make sure that they stay safe both in the hospital and at home. Thank you.